We all know it's important to eat healthy, but did you know that a healthy diet should start long before you're born? For the health of our soon-to-arrive baby, it's important for a pregnant mother to have a healthy diet. Not having enough of something, like a vitamin or mineral, is called a deficiency. Deficiency in a mother's diet can lead to poor health of the fetus and impact its development. In this video, we'll discuss the importance of maternal nutrition on fetal health. We'll chat about the risks of deficiencies and malnutrition and share some solutions to promote a good diet for the mother and a healthy, happy baby. Maternal nutrition was first considered a factor in child development during the 1980s. In a series of epidemiological studies, Dr. David Barker and colleagues found an association between infant mortality due to low birth weight from 1921 to 1925 and ischemic heart disease from 1968 to 1978 in regions of England and Wales. This indicated that the environment and nutrition the fetus received, resulting in increased low birth weight and neonatal mortality, also led to heart disease later in life. Today, Barker's hypothesis is known as the developmental origins of health and disease. This states that there is a relationship between prenatal and postnatal environments and disease outcomes later in life. In response to adverse intrauterine environment, the fetus adapts physiological development to maximize immediate survival, and this change manifests as altered phenotype at birth, which increases the risk of disease outcomes later in life. The degree of mismatch between pre- and postnatal environment is a major determinant of disease risk, resulting in catch-up growth, diet-induced obesity, and so on. More so, research has been collected from the 1944 Dutch famine on the effects of maternal nutrition on their offspring's health. By analyzing medical records of individuals conceived or born during the Dutch famine, studies have been able to find correlations between environmental factors and fetal health. One particular study by Roseboom and colleagues looked at the risk of a child developing coronary heart disease from in utero exposure to famine. The birthplace of over 736 individuals in their 50s were looked at, followed by an examination of their medical records. The results showed that 8.8% of the individuals exposed to famine during early gestation had some form of coronary heart disease versus only 3.3% of individuals exposed in late gestation. Moreover, 5 individuals had symptoms of angina, 8 had Q waves on their electrocardiogram, and 11 had a history of coronary revascularization. Another interesting study by Lumey looked at the medical records of females, either conceived or born before, during, or right after the famine, to find the effects of maternal exposure of mothers in utero to future obstetric performance. They found that mothers exposed to famine in utero during their first trimester had offspring with lower birth weights than women not exposed to famine in utero. This effect was not seen in mothers exposed during the second and third trimester. Now that we have all this information, let's take a look at some suggested dietary requirements for maternal health. According to a consensus document published by Maragoni and colleagues in 2016, pregnant women should only slightly increase their caloric intake per trimester. This includes an increase of 70 extra calories per day in the first trimester, 260 extra calories per day in the second trimester, and 500 extra calories per day in the third trimester. International guidelines also agree that 21 extra grams of protein intake for each day in the second and third trimesters are recommended for healthy fetal development. One other important molecule includes docosahexaenoic acid, or DHA for short, which is crucial for fetal brain and retinal development. Though the body can create DHA, it can also be found in fatty fish and cold seas. This is an important consideration for vegetarians, as they need to find alternative sources of DHA if their bodies do not generate enough on their own. DHA requirement increases to 100 to 200 milligrams per day during both pregnancy and lactation. Aside from these nutrients, intake of micronutrients such as iron, iodine, calcium, vitamin D, and vitamin B12 or folic acid are all recommended to increase up to 50% above normal levels. Consistent food access to the requirements we already discussed are necessary to maintain healthy fetal development. Currently, Mexico and Turkey are ranked lowest according to the World Health Organization, with approximately 1 in 3 children suffering from inconsistent food access. Canada and the United States are ranked 35th and 36th, respectively. Japan, Denmark, and Switzerland maintain the highest rates of consistent food access, so we can still aim to be better and provide the best for our children. Thank you for watching. If you'd like to learn more about important medical issues, be sure to check out McMaster University's Demystifying Medicine video series.